Currently, according to the WHO UNICEF report, 86% of the unimmunized children in Africa are in only 10 countries, and Uganda, unfortunately, is among these 10. It is, however, sad to note that Uganda has the highest number of unimmunized children in Eastern and Southern Africa. The number of unimmunized children in Uganda in 2011 was 118,881, and they have increased to 153,616 by the end of 2012. According to the Uganda Demographic Health Survey, the percentage of children fully immunized in Uganda stands at 52%, with measles coverage at 76%. The decline in immunization coverage in Uganda came about after the suspension of the Gavi funding in 2005 due to alleged corruption and misuse of funds. The decline was largely due to the shortfall in funds for parish and community mobilizers, who play an important role in mobilizing the community. We will continue to carry out static immunization sessions at health facilities with vaccine fridges within a radius of 5 kilometers. We also will continue to conduct community outreaches using the motorcycles in areas with a distance of 5 to 10 kilometers and beyond, and carry out the mobile community outreach programs, undertake supplemental immunization services to interrupt transmission whenever there is need to interrupt and an outbreak to prevent the transmission and spread of the diseases like measles and polio. Currently, there are 8 immunizable diseases in all public health facilities, and these are tuberculosis, polio, the diphtheria, tetanus, whooping cough, hepatitis B, Haemophilus influenza type B diseases. The private member's bill on immunization. This bill intends to address the challenge we are having with immunization. As you are aware, there are some religious groups that have also been moving around and telling people not to take their children for immunization. So we hope that once this bill is passed into law, any parent who does not take his child for immunization will definitely pay a fine as is proposed in the bill, that is if it is passed as it is, or be imprisoned for 6 months as it is stated in the bill. And we hope that this will compel parents to take their children for immunization. Most of our mothers were also not giving birth at the health facilities. So when you lose out on, when you do not attend antenatal care, you lose out on the valuable information that you are given at the time when you visit these health facilities. So because of that reduction, the mothers giving birth at the health facilities, they produce in the hands of the unskilled people in the villages, the traditional birth attendants. So you realize that most of these mothers then do not even, they miss out even on the first vaccine that is given to a child at birth. And this is part of the reason why we had that decrease.
Drugs cause some side effects, and also vaccines cause side effects. But vaccines do not kill any vaccinated person. So any room, as the Honorable Minister has said, we need to get more detailed information so that we can go out and carry out a thorough investigation of those so-called reported deaths. For the measles vaccine, when a child receives the measles vaccine, he or she can develop a mild skin rash, but it's not the disease, because it's some effects following the vaccination, and that one is basically showing that the vaccine is working. And finally, we have a national task force for advanced events following immunization, which was nominated by the Honorable Minister, and they've been trained, and they are ready to investigate and respond to all concerns as far as vaccines are concerned.